scalenes and SCMs are going to like drive the show. Lats are another breather muscle that will join if the diaphragm's not working. Randy, you're the only one on there. So your scalenes are your sniffers. So like if you see someone sucking air in like that, again, like you get used to like hearing for it too with their breath.
Like, and then it's sort of like out.
A good way to inhibit the scalenes in any of the like foundational PRI exercises is if they're doing a reach. So like if you reach your fingertips forward and your rib cage moves back, that rib cage retraction is going to then like impede these scalenes from drawing in.
Okay.
So you'll see in that flat back protocol that I referred to, there's a lot of reaching forward and rib cage moving back, or pressing against the wall, or the squat against the wall where you're reaching. You could even do a 90-90 hip lift. I did this with my patient the other day. It was way harder than expected. She's very barrel chested and like just up. It's just like a 90-90 with a both arm reach. And you're trying to allow them to keep their neck on the pillow and not like draw it up. So we have the cervical support, that little blue thing that I just got, a little round thing that's in there. And then I need to get a thin pillow, but like in that room, I always have like a thin pillow and a thick pillow, because if they need support, you might want to give them a little more pillow buildup, but if you build them up too much, then they're going to pull them in more. So sometimes I'm like, okay, let me give you a flatter pillow. Like if you put a really neck driven patient on a thick pillow, they're just going to use their neck more. So you just have to like find that balance.
That's what I was saying. Sometimes I'll just use like a towel roll or something too.
So anyway, that stuff is important even when you're looking at the rest of the body.
Okay.
Cool. Let's do some manual techniques. Who wants me to work on their neck? Allison, you want me to do it to you?
Why not?
Okay.
Let's do this over.
Keep enjoying.
Do you want this on video?
Nerve stimulator.
Or no?
What?
You
You can point it. That's perfect. Okay, go ahead. Sorry, girl, you have to like your butt. This is
Mommy,
darn, it's on video.
could you put a show on?
Not right now. You can place this. This is not the same table.
Oh, it's not.
Oh, yeah, I saw you got it
figure out whose fault it is. Why
Is it just the buttons, or
No,
is it
the head hole is totally different.
Oh,
I know.
That's like not great. I don't know. I haven't.
No, I know it's not great.
I don't know if
so
it's
frustrating.
my
It's something
there,
I'm
but-
just like, okay, I'm gonna have to approach. Can you give me that cream? Thank you.
We waited for like forever for it to come anyway.
I know, right? And okay, so I'm stepping on the button. It takes like a little second. All right, lift your head for me first. Okay, and then come down. So one of the first things I check is C1 or upper cervical rotation. So the upper cervical do like 60% of full rotation that your cervical spine can have. I said that weird, but it's a lot for the one joint to do it. So you lock out the lower cervical by bringing them all the way chin to chest. When I'm here, I'm also asking them, how much tension do you feel down your neck? Anything go in between your shoulder blades?
Like a little bit.
A little bit. Okay. If they have a lot of nervous system tension or dural tension, it's gonna be like, you're gonna feel it, and they're gonna be like, ooh, I feel the stretch down my bra strap, and then you're like, okay, now we got some nervous system tension. All right, and then so you just lock them out to whatever. Don't be forceful. All right, and then we're gonna turn right. So then you just see what they got. Good. And then you want it to be passive. Turn left. Good. And then come back down. So like what you're normally going to see in the right TMCC pattern is limitation to the right.
Okay.
So she has it a little bit. Makes sense. Bring it up again. Good. Let me move you.
I know, I'm trying.
Oh, there we go.
I was gonna say. Like,
that was better. But see her left?
I like forget all the times when you're like in PT school and you're like, oh, I have to like be a patient and just like relax there.
And then suboccipital release. Have you ever done that before?
I did it last night with Walker.
Okay, cool. I figured. I was like, I wonder if she's gonna ask him. So it's I just generally sit here for a moment, right, and just feel the tension underneath of your fingers. So the thing about suboccipital release is it's just a hold, and you just want that tension to melt away, and then you're asking them to breathe, and I'm just evaluating like right versus left.
Are you doing it now? How? Okay, so fingers, like the YouTube video that I watched was like fingers curled up under the occipital bone, and then you just let them relax into it.
You got it. Yep. There's definitely a lot more that you can assess like from this aspect, but we'll just start here and then we'll get into cervical first. So that will be fine. All right, I'm gonna give you your pillow back. No, you always hurt that.
I know, it's always the days that.
Okay, and then another spot I usually just am like checking in and feeling for, because these are spots where they might not even know they're sore, and you do though, because you see it. The SCM is gonna sit. You can go on this side of me if you want. So, what's this bone called? I don't even know. I forget.
Yeah.
Whatever. It's this pokey bone behind your ear.
Okay.
The SCM comes right off of that. So like if you're really gonna find it's like one finger down, that would be our like needle spot. If we were gonna go, that's like usually the most tender. So I can evaluate that, and then I'm also get a little cream, Allison a little bit of good stuff. I'm also, so this is really important for lymphatics. I'm also trying to like carve out her jawline. You okay? Because I don't want that all stuck. If someone has poor lymphatics, I'm a little stuck. You probably use me as an example. This is going to be, you're not going to be able to dive your finger in through there, and you want to. So I almost even sometimes take my two fingers on either side of the SCM to carve that out a little bit to just get some lymphatics going. And I might come to master and just help that. But pretty much it's almost like with the pelvis and the low back, and then you get the lower belly, everything's just guarded and clamped down. That's what you get around the jaw in the suboccipital. So it's like you want to just assess all the way around, whatever that's called, your occiput there. So usually we see right SCM is larger than the left, and so when you look at them, just look at their symmetry. Sorry, I'm just feeling so. Okay. What was I gonna say? Oh, look at their symmetry just from above. You can look at their. Can I take your glasses off? And this thing came up. See, I hate this table. Okay. All right. So I'm looking at her eyes. I'm looking at her nose because you'll see deviated septums. I'm looking at her jawline, like where the tip of her jaw sits. I'm looking at her sinuses because you'll see those are like. Yours are not. You're fine. You have a little bit of.
I did break my nose.
Septum's a little off.
My brother hit me with a metal baseball bat.
Oh,
when I was 7.
I hit myself with a baseball bat because I swung it into something and bounced back at me.
Oh my gosh.
So in through here, like masseters. Oh, thank you, sis.
You're welcome.
Temples or something I'll hit. If someone has sinus pressure, they cannot breathe, they can't take a nasal breath. Sometimes it's worth just coming here. You come to like the crease of their nose intersects with their eyeball, and you just hold. People really appreciate this. Sometimes they haven't ever felt like what this feels like to just hold, and it takes like 10 seconds. And it allows you to then feel their cranial bones even a little bit more.
Okay.
Because you have a feel. So I can like grab a picture for you, maybe probably slap it up with this video of just like some sinus pressure points.
Okay.
Because it becomes helpful during the cold season for people. Okay, I'll show you how to get to the scalenes.
Okay.
And then my little cool SCM release that I learned from a massage therapist. Alright, lift your head for me. Sorry. Alright, so you want to get them. See? I'm causing a lot of chaos. Okay, so the scalenes are going to sit under the SCM, so you have to like push it out of the way a little bit.
Okay.
And then you want to flex them up. I gotcha. You're doing pretty good. Pretty good. And then, so what you're gonna do, so I can feel her transverse process of her vertebrae here.
Okay.
And then the scalenes sit anterior to the transverse process. So see how, like, this is her SCM. So I'm finding the transverse process, then I'm going anterior to it, but I'm also pushing the SCM out of the way.
Okay.
And then my force is like a little bit medial, but mostly posterior. You okay? Are you sore?
No, it feels good though.
So again, like I can track her transverse process, and scalenes just sit on the front of that vertebrae. And you can adjust, but a lot of times or rotate toward, which will give you a little bit of slack.
They're just like waiting for Whitney.
I know.
Is she here?
So a little bit of redness, and you'll be able to feel. So go ahead and like sniff in. Not like hard enough to make your scalenes work. Sorry.